So my name is Susan Montgomery. I'm the director of the Leisure World Social Work Department. And today we're going to be talking about Medicare, everything you need to know and more. So I know there are a lot of people who don't know a lot about the Social Work Department. Next slide. We are located in the MedStar Medical Center, but we work with all of the residents in Leisure World, not just the residents who have MedStar. And our mission statement is to assist the residents of Leisure World to stay safe and independent while achieving life satisfaction in the community. Next slide. So I am going to start. Here we go. I'm going to start by introducing our amazing team. We have all of the social workers here today. As I mentioned, I'm Susan Montgomery. I'm the director of the department. I've been here for almost 10 years, and I am one of the full-time employees. And next to me, we have Wilma Braun. Wilma has been here for 25 years. She's one of our part-time employees. And while we all know about Medicare and understand Medicare, Wilma is our expert. So we go to her when we have questions. So next to Wilma, we have Sandy Hart. Sandy is also one of our part-time social workers. Sandy's been here for a little bit over 9 years. And she, again, is one of those people, we all know a little bit about Medicare. So next to Sandy, we have Ann Johnson. Ann's been here for 7 years. And Ann is also one of our full-time social workers. And then last but not least, we have Kelsey Van Dyke. And Kelsey has been here for a year and a half, and she's also one of the full-time social workers. Next. Oh, one other thing I just wanted to say about the last slide. If you notice next to our names, it says LCSW-C. And what that stands for is Licensed Certified Social Work with a Clinical Emphasis. And that's the highest level of licensure that you can get in the state of Maryland. I just wanted to mention that. Okay, slide 4. So most of you already have Medicare, or you're going to be insured by Medicare. You have earned your Medicare coverage by paying into the Social Security system for 40 quarters or 10 years. And if that isn't the case, you can also purchase Medicare as long as you're 65, a U.S. citizen, or a permanent resident. So this is a copy of the Medicare NU Handbook for 2024. Actually, last week and this week, the Medicare Handbook for 2025 is coming out. If you have Medicare or going to be eligible very shortly, you should have gotten a copy of this in your mail. It has a lot of really good information in it. I would encourage everybody to take a look. Next slide. So I'm going to talk a little bit about what are the parts of Medicare, and then we're going to get more in depth about this as we get through the presentation. So there are 4 parts to Medicare. There's Medicare Part A, and that's your hospital insurance. There's Medicare Part B, and that's your medical insurance, so that would be like doctor's appointments, medical appointments, things like that. We have Medicare Part C, and those are your Advantage plans. And there's Medicare Part D, and that's your prescription coverage. Next slide. So there is no cost for you if you or your spouse paid into Social Security. There is no cost for Part A. It is free. There is, however, a Medicare Part A yearly deductible, and the deductible for 2024 is $1,632. So you pay that first $1,632, and then your Medicare Part A kicks in. Next. So what does Medicare Part A cover? Well, Medicare Part A covers your inpatient hospital care. So that would be like, for example, if you went to MedStar Montgomery hospital up in Olney or Holy Cross or Suburban Hospital, it would pay for your inpatient hospital care. It would also pay for your acute rehabilitation hospital care. So an acute rehab hospital would be like the National Rehab Hospital downtown or the Adventist Rehab Hospital. These are freestanding hospitals devoted just to rehabilitation. It also covers subacute and skilled rehab in a skilled nursing facility. And a skilled nursing facility example would be like Bedford Court or Brook Grove or the Heber Home. Those are examples of subacute rehab facilities. It also pays for skilled home health care and also for hospice care. Next slide. I want to take just a minute and talk about observation. How many of you have heard about observation? Okay, just a couple of you. So observation refers to your status in the hospital if you have not been what they call formally admitted, and you're in the hospital, you are considered under observation. And that means that you're receiving short-term outpatient services while you're in the hospital, and they are monitoring you to determine if you should be admitted to the hospital. You can be in the hospital overnight or longer and still be under observation. So if you're under observation in the hospital for more than 24 hours, the hospital is required to give you a form. It's called a MOON, M-O-O-N. And what that stands for is your Medicare Outpatient Observation Notice. So they are required after 24 hours to tell you you're in observation. Now, when you're in observation status, your services in the hospital are actually paid for by your Part B at 80%, not by your Part A. So it's not until you're formally admitted does the Part A kick in. Okay, next slide. So everybody has to pay for Part B. Part A is free, everybody has to pay for Part B. Most people pay $174.70, and that is taken directly out of your Social Security statement. If you earn above $103,000 per year, there is an additional tax on your Part B, and that's referred to as an IRMA, and that stands for Income Related Monthly Adjustment. So that means that your monthly premium for your Part B, instead of the $174.70, could be anywhere between $244 and $594. Do you need a chair?
I need a chair.
Okay, you're fine. Okay. So just something to keep in mind, it is based on your yearly income. Okay, next slide. So what does Medicare Part B cover? Well, Medicare Part B covers your outpatient doctor and medical appointments at 80% after a yearly deductible of $240. You pay the first $240. Sometimes your Medigap plan will pay that, and then you are covered by your Part B. It also covers skilled home health care services, durable medical equipment. Now, it doesn't cover all durable medical equipment. It covers durable medical equipment that has been deemed medically necessary, and you have to have a doctor's order. And that could be things like walkers, wheelchairs, bedside commodes, hospital beds. These are all things that the doctor says are medically necessary. You can get coverage for those. Some things it does not pay for, rails in the shower, a shower seat, those things are not covered. A raised toilet seat, not covered. It also, Part B also covers mental health services, again, at the 80%. It covers preventative services such as your yearly Medicare wellness exam, and it actually covers that at 100%. Covers x-rays and also your lab services. So a lot of your outpatient services. Next slide. So what Medicare does not cover? Medicare, both A and B, do not cover most dental care.
Sorry.
That's okay. Part A and B do not cover eye exams for prescription glasses. They don't cover dentures. Medicare A and B will not cover long-term care in a skilled nursing facility. They don't cover hearing aids, and they don't cover a type of home care that most people could benefit from, and that would be home health aides, also known as certified nursing assistants. Again, we're going to go more into payment options for some of these things as we get through the presentation. So now I'm going to turn this over to Wilma Braun, and Wilma is going to be talking about Medicare supplemental and Medigap plans, as well as Medicare Part C.
Good morning, everybody.
Good morning.
Glad to see you here. I'm going to be in and out with my glasses. So as Susan has told you, there's a lot of gaps in the coverage that Medicare provides. Can you hear me okay? No? Okay. How about this? Is that better? Okay. All right. So there's a lot of gaps in the coverage that Medicare provides. That's where Medigap or Medicare supplemental insurance, two names for the same thing, is a way to get some help to cover those gaps. Medigap is, or a supplemental insurance healthcare, is offered by private companies. However, these companies are approved and monitored by Medicare. The policies have been the policies are individual policies. They're just for one person. If you're a couple, you need two. And they cover the gaps in Medicare. Medicare has standardized these plans, and they are alphabetically arranged. I wonder if I should, why don't you put the next screen up? They are alphabetically arranged so that you can be assured to know what is covered by each one. Could you do the next slide, please? Okay. Well, one minute. Anne's going to help me with this because it is a very busy slide, but this can give you an idea of what is covered through supplemental insurance. If you see on the top, Anne, the basic benefits are arranged in, unfortunately, alphabetical letters, okay, just like Medicare A, B, and C. This is not Medicare A, B, and C. This is your supplemental insurance. But what Medicare has done is standardize them so that any insurance that offers a D or a G will have the same benefits. You don't have to worry that it's different benefits. And therefore, when you're looking for a supplemental insurance, first you need to decide which plan you want, and then you can go shop for money for what the payment is in the different insurance companies. Okay? So if you look down the side, these are the different things that are covered in the policies. And if you look in the middle, it will tell you what is covered where. So for example, and G is now the most complete coverage you can get with a supplemental. Medicare has decided, they used to have an F. Some of you who have insurance now might have an F, but they no longer are selling that. The F covered the Part B deductible. As you see, nobody covers that anymore. So if you wanted as much coverage as you could get, you would have to get a G. And what you would do is pay that $240 deductible with when you first see the doctor at the beginning of the year, and you would have no other expenses in a normal time. Some things that I wanted to say to you is Medicare does not cover care outside of this country. But there are some of these policies, if you look under foreign travel, that do cover some care for emergency room or emergency care in other countries. So that's one of the things that you might want to look at. The Plan K and F, you can see them, have an outpatient limit. They're the only ones that do. The others, you just pay as you go. So you can use this guide, as I said, as a guide in helping figure out what kind of insurance you need. Okay, next slide, please. Thank you. So here are some things that we thought you might want to know about Medigap policies. Plans are accepted by any doctor who accepts Medicare. You don't have to worry about whether your doctor's on the platform. When you sign up, you can sign up to have coordination of benefits, and if you do that, your bill goes to Medicare, and Medicare automatically sends it to your secondary insurance, so it's seamless. As I said before, Medicare plans, supplemental plans, are individual, so if you're a couple, you need to each have your own. They cannot cancel your plan on you unless you're not paying your premium. So premiums on the plan can increase. Usually they increase because of inflation. It has to be a whole, everybody who has that plan gets an increase, not one person. There is one, I just want to warn you, there's one kind of plan. It's called Attained Age Rated, which you buy at your age, and every year they increase it. So I like to remind people to be very careful about that. So if you sign up for a plan when you turn 65, which is the first time you can sign up with no medical underwriting. Medical underwriting means that the company can ask you medical questions. They can ask you what diagnosis you have, what medicines you have, and they actually can make decisions about the cost of the plan based upon that. Medicare is not covered by Obamacare. You've heard that their pre-existing conditions are not a problem with the general population. Medicare is not under that system. So in this situation, I should say that differently. Medicare is standard, but the supplemental insurances can charge more for you if you have illnesses or medications if you change later in life. But when you sign up at 65, you will have no problem. There will be no asking of pre-existing conditions. There is one other time, the last year, 23 I think, the state of Maryland passed a law that on your birthday month, you can change your plan, your supplemental plan, without having to worry about medical underwriting. So I think that's really something important for everybody to know. Why would you want to do this? Well, people call and their plan has gotten very, very expensive and they just can't afford it anymore. You can only choose a plan less inclusive than the one you have. So let's say you have that, if you remember the chart, the G that covered everything. Perhaps you could then choose an N, which has less coverage, but you can choose that. Don't have to worry about underwriting, and you can get it for a lower cost. So on your birthday month, if you're having concerns, that might be something to think about. Think about it the month before. All right. You need to be a Maryland resident. You need to be enrolled in a supplemental plan in order to do this. Next slide, please. So Medicare Part C, Susan told you, is Advantage plans. An Advantage plan is another way that you can help to cover the co-pays and the deductibles of Medicare. What Advantage plans are actually separate insurance. They take your Part B payment that you make. You are no longer really under Medicare. You're under the new insurance that you are choosing. Now, Medicare does monitor these plans and make sure that they're, appropriate. But they bundle the A and B, and often they have the prescription, the Part D, with them. And as I said, they're sold by private insurers. So Advantage plans usually operate like HMOs, if you've heard that term, or PPOs. You often have to go to in-network doctors and facilities, and you need to get a referral from your primary to go to a specialist. If you decide to go outside of your plan's programs, you will not be covered by Medicare. You will be self-pay. So if you decide that you want to go to a hospital in, Texas, Anderson, if your plan doesn't cover that, and probably won't, you are on your own. Medicare will not cover it. You don't really have the Medicare. It is paying for your supplemental. For your Advantage plan. Now, there are advantages to having a Advantage plan. It's a good name, right? The premiums are usually a lot less than the supplemental insurance, and they offer services that are not covered by traditional Medicare, like eyeglasses, hearing aids, and dental care. So you do want to be careful when you sign up for an Advantage plan, that you are living in the service area of the Advantage plan, that your doctors are covered by it. You need to weigh the costs of the co-pays and deductibles because they have them, and as opposed to the expense of the Medicaid policy, Medigap policy. So I did want to take a moment just to caution you about the myriad TV ads. Maybe you've seen them. And I know you're getting lots of mail right now about Advantage plans. They can be misleading. They cover the whole country. They say things that might be appropriate in Iowa that aren't appropriate here. They say things that might be appropriate for people who have medical assistance for people low income that aren't appropriate other places. Please be careful when considering an Advantage plan. They can be a good fit, but you need to be careful and weigh the pros and cons, and feel free to call us or SHIP, which I'm going to talk about later. It's an organization that has trained volunteers that help people with insurance questions, and to explore these options before you sign up. Okay, I'm going to now turn this over to Ann, who's going to tell you about Part D.
Good morning. Can you hear me okay? Okay. Yeah, I'll be talking to you today about Part D, which is the medication coverage or the prescription coverage of Medicare. Next slide. You sign up for Part D at the age of 65, or when you once you retire. When you're also signing up for Part B, we recommend that you consider signing up for Part D at the same time to avoid a late penalty. When signing up for Part B or D, some people may not have any medication costs at that particular time, but if you wait until later on, down a couple years, a year, 5 years, to sign up, when you do have medications, you will be penalized. And this penalty is not just a one-time penalty, it's a penalty for life of your coverage of your Part D. So we recommend, if you don't have medications at the current time, is that you look at a plan that has a very low monthly premium and that will cover the medications that will come up down the road. So this lifetime penalty, it's a late fee of 1% of the monthly Part D premium that is charged for every month for the number of months that you were eligible for Part D and you did not enroll. So does that make sense? You just have to be very careful. That's why we really encourage signing up. And so again, this penalty will stay with you for your lifetime of the plan. So one of the things is that it's very important to review your medication cost or coverage yearly during the open enrollment, which is going to start October 15th through December 7th. Because each year, premiums change, the tiers of your medications change, the cost of medications change, and medications can also be dropped from the plan that you're currently on. So the main thing we want you to know is do not assume everything is going to stay the same from year to year to year. Next slide. There are two ways to get Medicare Part D. You can join a Medicare approved plan, or like Wilma was saying, you can join a Medicare Advantage plan, which is Part C. Next slide. So there are three ways to sign up for Part D. You can go online to medicare.gov, or you can call Medicare at their number, which is 1-800-MEDICARE, or you can contact SHIP. This is the program you'll hear talked about in different parts today. So if you're using the Medicare.gov website, what you do is that you enter all your prescription medications that you're taking, and it will go over different plan options. And then you need to there's several variables you need to review for. You need to check to make sure all of the medications that you're currently taking are covered. How much is that premium going to be that particular year? And does it have a deductible? Are there co-pays? Is there a prior authorization needed for a particular medication that you're already on? And does it require a step therapy process for a particular medication? The third way to sign up for Medicare Part D is a program called SHIP. It stands for State Health Insurance Assistance Program. This is a free state and county-run program that provides free, unbiased, one-on-one insurance counseling and assistance with Medicare Part D selection. Next slide. Another thing that we need to bring to everyone's attention is something that's new for this year, and this is for Maryland State retirees and their dependents. And this is, so what's happened is that Maryland State retirees now have to pick your own Medicare Part D prescription plan. And this will not be done automatically by the state of Maryland. This is something that each retiree or their dependent has to do themselves. The state of Maryland has extended a special enrollment period from October 1st through the end of the year, December 31st. They've gone further, and they've also partnered with a company called Via Benefits. And they're offering for the retirees or their dependents free guidance, counseling, and enrollment help to find the best plan to help meet your needs. And to reach Via Benefits, you can call the number that's listed here on the slide, or you can also go online to their website to enroll. Okay. Next slide. So Part D helps cover the cost of your prescription medications, shots, and vaccines. The plans are run by private insurance companies, and they follow the rules that are set by Medicare. The costs are approved by Medicare. Plans are specific to our area, to our zip code. So example, if you move to a different county, if you move to Howard or PG County, you have to check to make sure your plan is covered at your new location. If you move from state to state, it's the same thing. You cannot assume that your Humana is going to be the same in Texas as it is here in Maryland. The premiums and drug costs change yearly, so it's important to reevaluate during the yearly enrollment period. You're going to kind of hear that a bunch today. Next plan. Next slide. The cost of the plans can vary, and not all plans are the same. As I said, prices can change each year, and you may have to pay a monthly premium. There are deductibles, which is the amount you have to pay out of your pocket before Medicare will pay for the prescriptions. There may be a copay, and there may be some co-insurances that may exist. Okay, so this next topic, next slide. Sorry. This can be a little confusing at times, but the medications are broken down into things called formularies. And this is a list of medications that each specific plan has that they cover. And then those medications are broken down into what is called tiers, which is a way for the insurance companies to determine the cost of a medication. Each tier has different cost. The higher the tier, the higher the cost. So tier 1 is your common generic medications, which a lot of the medications are on this tier. Tier 2 is where you have generics and brand name medications. The price gets a little bit higher. Tier 3 are your medications that are total brand names that don't have a generic. And then tier 4 are your specialty medications. And so that's going to be the highest cost. Sometimes a doctor can ask for an exception to Medicare to move a drug to a lower tier if, especially if the lower tier medications have been tried and have not worked for you. Again, the formularies with your medications can change at any time. One of the things that happened in 2023 is that insulin was capped at $35 a month for diabetics. Next, Kelsey will be talking about home care.
Hi, everybody. I'm going to be talking today about Medicare coverage of home care. So this means, in a broader term, care that you can receive at home, care in the community. Next slide. So when we talk about home care, we're talking about two different things. This can refer to two different things. One would be skilled home care, and the other is non-skilled home care. So skilled home care is the first thing I'll be talking about. You've also maybe heard it referred to as home health or skilled home health, skilled home health care. Both Medicare Part A and B cover skilled home care. It is a service that must be ordered by your physician. It must be provided by a Medicare certified agency. And you have to have a primary care doctor. So your provider, your primary care provider, has to have seen you within the last 3 months, or you anticipate you'll be seeing them within about a month of starting with skilled home health. So for Medicare's purposes, you have to be considered homebound. What this means is it would be a lot of trouble for you to leave home. You can't leave home because it's not recommended due to your condition. You can still go to medical appointments, you can go to religious services, but if you're, going out grocery shopping, visiting friends, things along those lines, that's not considered homebound. Your doctor has to certify that you have one of the following skilled needs. So that's skilled nursing, physical therapy, occupational therapy, speech therapy. Social work, medical social work can also be involved if one of these other disciplines is already in the home providing care. And also home health aides may be offered if one of these other disciplines is involved. It's important to note, people hear the term home health and it's, there's some misunderstandings at times about what that could cover. Home health aides are generally a very limited service under skilled home health. They may come 1 or 2 times a week to help specifically with bathing, showering, that kind of thing. They wouldn't be in the home for an extended period of time. Skilled home health is generally considered to be a short-term service. So the goal is rehabilitation generally. The thought is, the person's had an injury or a lengthy hospital stay, some sort of illness they're recuperating from that requires this service. A previous hospital stay is not required to receive skilled home health. Just as I was saying before, skilled home health does not provide 24/7 care. So it's not ongoing care in the home. It's intermittent. A physical therapist might come a couple times a week. A nurse might visit once or twice. It's going to vary a lot depending on what's going on with the individual patient, but it is not ongoing care for several hours a day in the home. Next slide. So non-skilled home care is kind of what we think of as the more day-to-day caregiving. It's sometimes also called custodial care, and it's not covered by Medicare. Non-skilled care can include assistance with activities of daily living, bathing, dressing, eating, getting to the bathroom. Non-skilled care is provided typically by a certified nursing assistant, also known as a home health aide, or you might hear the term caregiver. Just something to note, it's not unusual to have both skilled home health and also choose to hire non-skilled home care at the same time. So let's say you've had a major surgery, you're recovering at home, you may choose to hire a non-skilled home care agency to come, 4 hours a day to help you with things around the house, get you into the shower, things along those lines. And then also have skilled home health coming in, where it may be a physical therapist 2 or 3 times a week, helping you with exercises to rehabilitate. So these are 2 different services provided by 2 different agencies typically. Non-skilled home care can be anywhere from 1 hour a day to 24-hour care or live-in care. It is typically paid for privately. However, long-term care insurance may be able to help cover the costs depending on your policy and benefits. So I'm going to move on now to talk about coverage of hospice care under Medicare. Hospice, like Susan was saying at the start, is a benefit covered under your Medicare Part A. Medicare covers hospice at 100%. So hospice is comprehensive care for a person who has been determined to have a terminal illness. The care is aimed at alleviating symptoms and maximizing the patient's comfort. So Medicare does require that 2 physicians certify the patient has a life expectancy of 6 months or less. However, hospice can continue for longer than 6 months if the patient continues to meet Medicare's hospice criteria. When someone is enrolled in hospice, they're choosing to receive hospice care versus pursuing curative treatments for their illness. The patient can revoke their hospice care at any time. Medicare does allow you to opt out at any time and return to hospice later if you choose to do so. Of course, the patient would have to meet the Medicare criteria to enter hospice at that time. And patients also sometimes do graduate, quote unquote, from hospice. That they would be discharged if their condition improves or stabilizes. And something to note that people may or may not be aware of, but hospice is provided wherever the person lives. So you don't necessarily go to a hospice facility. It's typically provided at home or wherever the patient lives. If that's an assisted living facility, a nursing home, that is still considered home hospice for the purposes of Medicare. Next slide. So under Medicare's hospice benefit, the services do include a nurse visit at least once every 2 weeks, visits from a social worker, chaplain, a home health aide if needed. And these, again, are similar to home health. They're intermittent services. So they're not necessarily there in the home many hours every day. The hospice physician or nurse practitioner may also visit periodically. All durable medical equipment is provided through hospice once the patient has signed on with hospice, their medical supplies, and any medications that are needed to manage the condition. Just quickly, volunteers are also a big part of hospice. Other supportive services can be offered, like pet therapy, massage therapy, things like that, but those are not required to be offered by Medicare. Next slide. Just going to talk briefly about inpatient hospice, which again is part of the hospice benefit under Medicare Part A. How or when would inpatient hospice be covered? So the hospice team would have to determine that the patient needs a higher level of care than what's considered routine home hospice. So in these cases, the person would then be able to stay in a hospice facility for the short term while symptoms are being managed by doctors and nurses on site. So an example that many people may have heard of or here locally would be Casey House. That's considered an inpatient hospice facility. And some hospitals do offer inpatient hospice as well for patients who have severe symptoms that just cannot be managed anywhere else. I'm going to turn it over now to Sandy to talk about skilled nursing facility coverage. Oh, we're going to take questions at the end. I apologize.
Hi, can everybody hear me okay? Okay, I'm going to talk to you about Medicare and skilled nursing facilities for rehabilitation and skilled nursing care. So, next slide. First, there's criteria for skilled nursing facility coverage, and this is for subacute rehab. First, you have to have Medicare Part A. You need a 3 overnight hospital stay, no observation. Remember Susan talked to us about observation? If you have observation, that's not going to allow you to have that, meet that criteria. A doctor needs to certify that need for daily skilled care, and advantage plans may vary. So advantage plans may say, I think as Wilma was talking, that you can only have certain doctors in with an advantage plan. Well, there's only certain nursing facilities, rehabs, that will accept certain advantage plans. So that's one of the ways that might vary. Next slide. So what is covered in a skilled nursing facility? Well, you'll get your semi-private room, meals, nursing care, physical therapy, occupational therapy, and social work. I do want to say that if you meet the criteria for a stay in a subacute rehab, it's a good idea to take it because your physical therapy, your occupational therapy will be more intense than you will get in home, as Kelsey was talking about. So, you'll get it every day rather than a physical therapist coming a couple times a week. The other thing is it's covered, and I'm going to talk about that next time. Medicare does not pay for long-term care. Long-term care insurance and private pay coverage for long-term care pays for that, and Medicaid can cover long-term care. So remember, Medicare does not pay for anything long-term. Next slide.
You do this one. Cost of skilled
Cost of skilled nursing. That was mine. Medicare pays the first day to the 20 days at 100%. Day 21 to 100, Medicare will pay all but a copay, and I think it's $204 a day, which is pretty pricey. Not all coinsurances have coverage, and you must continue to meet criteria for that Medicare coverage. So no one automatically gets 100 days. You need to hear that. Nobody automatic. In fact, in the 18 years that I worked in a rehab facility, that only happened a few times. It's very rare. Your therapist will create goals with you, And as long as you participate in those goals and progress towards those goals, Medicare continues to cover. But as soon as you plateau or reach those goals, Medicare stops, and then you are discharged from Medicare coverage. Now, Medicare, that doesn't mean you're discharged from the facility, you are discharged from Medicare coverage. So the next plan would be where, to either send you home, or if you need to stay there, you'll just have to start paying privately. Now, there's a right, next slide. There, you have a right to appeal. If you feel that your Medicare coverage is ending too soon, you can appeal. Actually, the skilled nursing facility will give you a paper that you have to sign, and you can say, no, I want to appeal this, and they will appeal it. But generally, they really want to work with you. They really want you to succeed. So, but if you feel like you're being, it's ending too soon, you can appeal. And I've seen appeals being over that Medicare will go, oh no, they too need some more therapy. So I've seen that happen before. Now I'm going to turn this over to Wilma to wrap up this program by talking about some state and federal programs to help with these Medicare costs.
Hello, everybody. I'm back again. So I'm going to start with how do we sign up for Medicare? We've talked a lot about what Medicare provides. Is that okay? All right. Can you hear me now? Good. Okay. So there are different times in the course of a year or a lifetime that you can make changes or sign up for Medicare. The first time is when you turn 65. That is your first opportunity, and you do actually have that period of time 3 months before you turn 65, the month you are 65, and 3 months after to sign up. You need to be active in signing up. Medicare won't, Social Security won't just sign you up. You have to call. You have to, you can either talk to people online, you can talk to a person on the phone or in the office, and you can do it online. But you have to initiate that. You can, at 65, you can have a choice. You do have the choice of just signing up for Part A. If you remember, Part A doesn't cost you anything. It covers hospitalization. Part B, which covers your outpatient care, your doctor appointments and all. If you are working and you have medical insurance through work, and if you're working for a company with at least 20 employees, you can choose not to sign up for Part B. Part B, as you remember, you pay for. So as long as you're covered by another insurance, you can decide not to sign up at that point. If you decide to wait, you do need to sign up when you retire, within 8 months of retirement. Anne mentioned penalties. I think I'm going to go into them a little bit myself. And this is, these deadlines that we talk about are, all right. Next slide, please. Gotta find my thing for this. What is it? Okay. Oh, this is all right, okay, so the next period of time that you can make any changes in Medicare is every year during open enrollment. Open enrollment is October 15th to December 7th. And as Anne stressed to you, it is really important for you at least to look at your prescription coverage, because prescription coverages change every year. So you want to take a look at what you have and make sure it's working for you, and if not, change. This is also a time that you can sign up for an Advantage program. You can change. I think I need the next slide. Sorry. You can change from Medicare to an Advantage plan, from one Advantage plan to another, from an Advantage plan to original Medicare, and you can also change your Part D. Okay. Okay, next slide. There are some other enrollment periods that I wanted to mention. One is the Medicare Advantage enrollment period. That period is actually from January 1 through March 31st. They call it I made a mistake. They don't call it that. I'm saying it is an opportunity for you to drop out of an Advantage plan if you think you've made a mistake in choosing one, or to change from one Advantage plan to another. You would need to have an Advantage plan to use this period of time, and you can't you have to deal only with that. Open enrollment, you can do any kind of a change, but this is specifically for the Advantage plans. The special enrollment periods are times that you can change your coverage because of special events in your life. For example, you were enrolled with a union and you're no longer involved with the union. You can then sign up for your Medicare. Maybe you were eligible for medical assistance and you came into an inheritance and you lost your medical assistance. Those are special enrollment periods, and there are many, many of them. As your life situation changes, you can use one of those special enrollment periods. Next slide. One of the most common special enrollment period is moving from state to state. Medicare is a federal program. You don't have to worry about your Medicare if you move from state to state. All you have to do is let Medicare or Social Security, actually, that you talk to and give them the change in your address. But if you have an Advantage plan, that plan might not operate in the state you're coming to. So then you do need to make sure that your plan is operational, and if not, you have to change. You have 2 months from the time that you move to make changes in that plan. Next slide. Sandy talked a little bit about Medicare appeals. I just want to say briefly that 1 in 7 claims filed with Medicare is rejected. The reason for these rejections can be as simple as insufficient or inaccurate information on the claim form, or an erroneous procedure code. So please think about appealing any rejected claims. There's instructions on the Medicare.gov website to help you with that appeal, and you can also ask your doctor to help you, particularly if the procedure code is inaccurate. He can change that for you, or she can. Be sure to write your Medicare number on all documents and your name, and keep copies. Make this request within 6 months of receiving the denial, and you can appeal any decision Medicare makes. As Sandy mentioned with the nursing home, you can also appeal prescription denials and Advantage decisions. Next slide. Medicare fraud. You hear a lot about this, I think, on the TV. But it does cost taxpayers billions of dollars. You can help. Do not give out your Medicare number to anyone except your physician's office or hospital. Treat your Medicare card like you would a credit card. Be careful with it. Medicare will never text you or email you or contact you through the social media and ask for your Medicare number. Be very suspicious of any calls you get like that. Never accept free medical equipment being offered by a cold call in exchange for your Medicare number. Carefully review your Medicare summary notices and explanations of benefits and report any discrepancies to Medicare immediately. Okay, next slide. So as we've heard through the course of this time together, there are a lot of costs in healthcare today, and it can get very, very expensive. There are some programs to help people who are low income with those costs. The first one and two are tied together. They're both federal state programs. QMB means Qualified Medicare Beneficiary, and it will pay both the Part B premium, that money that comes automatically out of your Social Security for Part B, and even the and it will also pay any of the Part B deductibles and A and B deductibles and copays. Eligibility, of course, is depending on your income and your assets. If you're single, you have to have an annual income of less than $15,060 and no more than about $11,000 in assets. Your assets do not include your home. Home is always an exempt asset. The other program, the one next to it, SlimB, has the same kind of criteria with higher income levels, but it only pays the Part B premium. It does not cover the copays and deductibles. So if you're single and your income is below $20,000, you might be eligible. The asset level is the same, $10,600. The third program up there, the Low Income Subsidy Program, or some people call it the Extra Help Program, is also a federal program. The guidelines are not set by the state but by the feds, and it reduces the cost of your medications and your Part D premium. If you're single and your income, and when I say income, by the way, it's gross income, not net. Your gross income as a single person needs to be below $22,840. You can have assets of $6,660 and still get extra help. There's levels. If your income is lower, you get more help than if your income is higher. The next program on the slide is a Maryland program. It's called the Senior Prescription Drug Assistance Program, and it will pay up to $75 of the monthly cost of your Part D premium. It is only for prescriptions. And another benefit of this program is that you can actually change your Part D program, your plan, the company that you deal with, once a year outside of open enrollment. And that can be a big benefit for people. This program has a higher income level, $45,180 for a single person, and they do not look at assets. And I would say if there's any Maryland retirees in this room, that you might want to look at that program once you're enrolled. You're going to be newly enrolled in Part D, you might be eligible. There's also pharmaceutical patient assistance programs that many of the pharmacies will help you cover very expensive medications. You do have to apply. All the companies have different criteria. So we in the social work department are happy to help you with that process if you need it. Companies also provide coupons. There's programs like GoodRx, you might have heard them, Single Care, and many others. You sign up for a card and you can shop the prices. Sometimes they give you a discount. So these are all good things to look at if you're having problems financially. Next slide. Ann did talk about SHIP. I wanted to go over it briefly again. This is a program run by the government. The state governments, each state has a SHIP office. It stands for State Health Insurance Assistance Program. These programs are run by trained volunteers, well, there's paid staff that train volunteers, and they help guide people through the Medicare maze. They have literature on Medigap policies. Our SHIP has actually a big book. Every year they put it out of what all the different insurances in, supplemental insurances in our area, in our county, how much they're charged for different things. They help people select Medigap policies, Advantage plans, and Part D plans. So you can, these are the ways to reach the SHIP office. They have a website, and on that website, you can actually, let me back up. Starting October 1st, on that website, they will have a form that you can fill out to request that they look at your Part D. You can fill it out online. You can download it and fill it out and email it to the second number there, the ship@accessjca.org. They have an address on it too. I'm sure you can mail it in. They do have all kinds of other information, but I think it's important for you to know that this form will be available, and we are going to have that form available in the MedStar Health Center after it's prepared. So as of October 1st, we will have copies in the waiting room and in our offices. The phone number is there for your information. Please know that the phone number will go to voicemail. They don't answer it, but they will get back to you. So just be patient, leave your message, and they will get back to you. Okay, I guess I need the next slide. So, we are here to help you any way we can. Next slide. This is the information on how to reach social work. We are located in the MedStar Health building. I think Susan mentioned that to you. This is the phone number and the email to reach us. We did put our cards on the table. Feel free to take them if you wish. Thank you so much for coming.